Hello friends, let us now learn some of the important things about acute pancreatitis. In the last class, we have learned the division of acute pancreatitis into mild acute pancreatitis and acute necrotizing pancreatitis. Then we have seen what are the common causes of mortality. Now, let us see the causes of acute pancreatitis. Acute pancreatitis can occur in the setting of gallstones, especially in the liver, in the gallbladder. There might be formation of some gallstones which might actually the this is the cystic duct, this is the hepatic duct, common hepatic duct, this is common bile duct. Now the common bile duct will combine with the pancreatic duct, and it at ampulla of Vater, it is opened into the, it drains into the duodenum, second part of duodenum. Common bile duct combined with the pancreatic duct, and both these at ampulla of Vater, these both are drained into the second part of duodenum. So whenever there is a stone in the gallbladder, or whenever there is a stone at the common bile duct, so both these are main causes of acute pancreatitis, and these are actually most common causes of acute pancreatitis. Why? Because whenever there is gallstones, while they are entering the duodenum, they might even obstruct the pancreatic duct. When they obstruct the pancreatic duct, obviously the enzymes which are present in the pancreas will get accumulated here. And if you remember, the pancreatic enzymes are, many of them are lytic enzymes. So they might dissolve the tissues of the pancreas, resulting in pancreatitis, and these are more common with patients with alcohol abuse also. Now, so one more important association is that if the surgery of removal of gallbladder, which is called as cholecystectomy, was done along with removal of common duct, that is common bile duct stones are also if removed, this will prevent the acute pancreatitis recurrence. This will prevent the recurrence. This is one thing which is found out incidentally. Incidentally, it is found out that not incidentally, actually on prospective studies which they do, it was found out that cholecystectomy along with removal of CBD stones will prevent the recurrence of acute pancreatitis. One more important thing is that gallstones, if the patient already has gallstones, these gallstones will cause pancreatitis in 30 to 50% of patients. There is acute pancreatitis can occur due to gallstones. Gallstones can cause acute pancreatitis in 30 to 50% of cases, whereas gallstones will cause pancreatitis in 30 to 40% of patients. Whereas if you see a patient with pancreatitis, and if you see whether the patient has gallstones or not, then only 3 to 7% of patients with pancreatitis will have gallstones. So gallstones will cause 30 to 50% of pancreatitis, but only 3 to 7% of pancreatitis will result from gallstones. Even there is one more thing called as biliary sludge. What is this biliary sludge? In biliary sludge, actually there is gallbladder. Inside the gallbladder, if there are very micro, what do we say? If the if there is saturation of cholesterol is present, saturation of bile is, supersaturation of bile is present, and there can be microlithiasis. This biliary sludge is called as microlithiasis, where the stones will be very small, and this biliary sludge or microlithiasis is the most common cause of idiopathic pancreatitis. It is the most common cause of idiopathic pancreatitis. Then sometimes some of the infections can result in pancreatitis, and even presence of neoplasm, some tumor, can also result in pancreatitis. if the patient has pancreatic divisum, where the pancreas in pancreatic divisum, there is one pancreas, there is ventral bud. In the pancreas develops from dorsal and ventral buds. So here, actually, the pancreas develops from dorsal and ventral bud. The dorsal bud will give rise to the head, body, and tail of pancreas, whereas ventral bud will give rise to the small part of head and the uncinate process of the pancreas. Now, if there is actually these dorsal and ventral bud, both of them will fuse in the embryonic period. But if the dorsal bud and ventral bud fails to fuse, then this results in a condition called as pancreatic divisum. Fusion of dorsal and ventral bud will result in fusion of the main pancreatic duct and accessory pancreatic duct also. But because in this pancreatic division, the dorsal and ventral pancreatic ducts fail to fuse, so the main pancreatic duct and the accessory pancreatic duct will not fuse. Okay, and here at the ampulla of Bader, mainly the uh, gallbladder, that is the cystic duct, common bile duct will come and attached. Along with the accessory pancreatic duct, it drains into the second part of the duodenum. So whenever there is pancreatic divisum, there is a higher chance that the patient might have the acute pancreatitis. Then, if the patient takes any toxins or drugs, or if the patient has any genetic history of some genes or genetic things, or if the patient has any trauma, or if there are any iatrogenic factors, that is, it can be due to endoscopy, or if it is post operative therapy. Okay, all these will result in acute pancreatitis. Or if the patient has any pancreatic tumors, or if the patient is suffering from any pancreatic or biliary tumors or gallbladder tumors, all these, either they are benign tumors or malignant tumors, so all these can result in acute pancreatitis. So these are the causes of acute pancreatitis. Thank you.